Welcome. My name is Katie McMullen. I'm a social worker at Children's of Alabama and a certified asthma educator. I'm here today to talk to you about keys to a successful asthma home visit. Our objectives for this presentation are to learn strategies for preparing for an effective home visit, learning strategies for assessing patients' adherence to medications in the home environment. We want to learn the importance of reinforcing asthma self-management strategies through device review and reviewing the asthma action plan. Participants in this session will learn strategies for integrating asthma education into the home visit. And we're going to review ways to integrate the EPA Asthma Home Environmental Checklist into the home visits. Preparation is key for a good asthma home visit. The first thing that you want to do is contact the patient's primary care physician and any asthma specialist that may be directing the patient's asthma care. It's important to have a copy of the patient's most recent asthma action plan that includes the patient's current medications and doses and frequencies of the medications that they take. Talk with the doctors and their representatives about any concerns or problems that arose during their clinic visits that you may be able to address during the home visit. Another thing that it's important to talk with a physician or their representative about is any known environmental allergens that the patient may have, because that's something that can be addressed during the home visit. A third thing is to check the patient's refill history. Make sure that the medications being filled match the medications being prescribed. What we've learned is that sometimes patients will call the pharmacy and say, fill all of my asthma medicines. Well, there may still be medications on the patient's profile that have been prescribed in the past, but they're not the most current medications. So it's important to make sure that those medications match with what the prescriber intends for the patient to be on. Also, when you contact the pharmacy or you look in the system, see if the patient has had any recent prescriptions filled for oral corticosteroids, as this could indicate a recent asthma flare-up. And finally, make sure that you have all the tools that you need for the asthma home visit. This includes the EPA Asthma Home Environmental Checklist, any educational tools that you intend to take with you, and any environmental remediation tools needed. The first step in the home setting is assessing medications. You want to make sure that you ask to see all of the asthma medicines that are in the home. Sometimes in home visits, families will just start pulling medications out from the bathroom, from the kitchen cupboard, from the child's bedroom, from the parent's bedroom. This gives you insight into how that family cares for the child's asthma, their organizational structure, and this can lead you to a starting point about a conversation for making sure that medicines are stored properly, that they're stored in a way that they can be found when they're needed, that they're stored in a way that's safe in an environment where there are children. So this helps you understand a lot about the family's coordination, and so that's an important thing. Again, you want to make sure that all of the medications in the home match the medications that are prescribed and that are intended to be the medicines that the doctor wants the child on at this time. If there's more than one asthma patient in the home, make sure that the medicines are separated out by individual and that the patients are only using the medicines that are actually prescribed to them and that they aren't being substituted for different patients, as this can lead to confusion and danger. Help the families discard any medications that are out of date and then get replacements for those if needed. And certainly work with a provider if you need to do that. Finally, help the family label medications with instructions whenever possible, and you can work with the pharmacist on your team to do this. But asthma medicines are usually, when they come from a retail pharmacy, are generally in boxes and the labels are put on the outside of the boxes. Well, families typically take the medicines out of the box, discard the box, and then they don't have the label that goes with the medication anymore. So it can be helpful if we can label the actual canister with the medicine in it. And our pharmacy teammates are great help in doing that. The next step to a good asthma home visit is asthma device review. Effective delivery of asthma medication is entirely dependent on good technique. And the asthma medicine can only work if it's delivered properly and adequately to the lungs. And that's why this is such a key to good asthma care. So you always want to review asthma device technique with an age-appropriate patient or the parents or the caregivers. And in addition to that, always teach it if the technique needs to be taught, teach the technique, but always, always, always have the patient or parent demonstrate that technique to you. Remind the parents and the child that spacers really are durable medical equipment and that they need to be treated that way. They need to be stored properly. They're not toys. And we never know when insurance regulations are going to change, when these devices are going to become more expensive and more difficult to obtain. So it's really important to keep close eye on these devices and to take good care of them. Also help families understand different family dynamics are such that different children are given different responsibilities at different ages for managing their own disease and managing their own medication administration. One of the things that you can do in a home visit that you can't always do in the office setting is get a feel for how much responsibility the child in the setting has for their own medication management and really help parents figure out whether or not that child's maturity level matches the level of responsibility that they're being given for their medication management and help that family make a plan that matches the maturity level of the child so that correct parental oversight is being given for medication management so that we can ensure that the child is getting the medication that he or she needs. Asthma action plans are key to good asthma management outside of the doctor's office, outside of the hospital setting. As we've said in previous presentations, these are the documents that help families manage their child's asthma once they leave clinic visits. So it's key to making sure that these documents are present in the home, and it's also key to making sure that they are integrated into the family's daily life. So not only do we want to make sure that they have an asthma action plan when you visit the home, but we want to make sure that it is present in a place in the house that is easily accessible to the family when the child is having a flare-up. Common places that I've seen them displayed are refrigerators, or oftentimes a parent, I usually suggest the refrigerator, but a common place that I've seen that parents like to have them is like on a mirror in their bedroom or on a dresser in their bedroom. That seems to be a really accessible place in the middle of the night if the child is having an asthma flare-up. A key thing, and I can't stress this more strongly, is to actively review the asthma action plan and to come up with creative ways to convey this information. So asthma action plans aren't very effective just as a piece of paper. So if we just hand them the document and say, here, this is your plan, they're just going to get lost in the shuffle of everything else that a doctor hands you, everything else that's in a child's backpack. In that sense, they're not very helpful. But if we can really teach the information that's on that plan, ingrain in the family what is in that plan, then they can be life-changing to a family and in an extreme situation, life-saving to a child. Things that you can come up with. Role play with the family what you would do based on symptoms. How would you respond to those symptoms What medications would you give? What steps would you take? When would you seek extra help? I've done quiz shows. I've done Jeopardy. The nurse practitioner that I worked with would walk through steps of calling. She would pretend to be either the patient or the provider and pretend to be on the other end of a telephone call with the patient, or pretend to be the pharmacist on the other end of the phone call. Whatever it takes to help these families be confident that they know what to do with these action plans is what we should be doing in the home. And finally, for low literacy families, and this may be low, here we're particularly talking about actual low literacy, not just low health literacy. I have rewritten or drawn asthma action plans. For example, when medicine is given day and night, you might use sun for day and moon for night, but using symbols or very simple words if that is what's needed to be done to help families understand. Asthma education should be included in home visits. It's an important opportunity to provide education in a way that is relaxed and invites back and forth between the educator and the family. Reviewing the asthma action plan is a great place to start with this and provides you with good insight as to what the family understands. There's no need, if the family really understands how the medicine works and what to do, then you don't have to keep hammering this. But if not, then we want to engage families. We want to provide them with what's needed. In short, we want to meet them where they are, pick up on what they've gotten from the provider, reinforce that, and then take it a step farther. We also want to engage them in discussions about triggers by asking them what they think makes their child's asthma flare. Always communicate to families that with the right strategies, with the right follow-through and medication, that asthma is something that can be well controlled. That we believe that their children can do all of the same things that other children can do, and it's just a matter of finding the right treatment for them. That really empowers families and reinforces the idea that this is a team endeavor and that there is good reason to keep going with this. And let the family guide their education with the questions that they ask. Assessing for environmental triggers is a key component for asthma home visitors. Talk with the family about what known triggers their child has for asthma, and focus your energy in these areas. We want to introduce the family to the idea of looking at triggers throughout the house. I've often shown the family the EPA Asthma Home Environmental Checklist that I've used in the home. Let them know that this is just a common tool for evaluating asthma triggers in the home, and that you're just using this to help guide a discussion, that you are not a health inspector, that you are not a home inspector, that this really is just about reminding you what things you're looking for in the home. This can be an intimidating part of the discussion for families. After all, you're in their house and you are looking at things that are very personal to them. So just be very conscious of that as you move through this activity and sensitive to that. In the next slide, we're gonna talk about things that we can do to remediate triggers. But just remember, for families, this can be a lot to digest in one setting. Be respectful of that and try not to overwhelm them. And remember that this can be done over the course of multiple home visits and multiple telephone conversations. This feedback can also be given to providers, and they can reinforce it during the course of clinic visits as well. steps to take after you've completed the EPA Asthma Home Environmental Checklist, things you want to review. Provide education for the family around ways to reduce exposure to known environmental triggers. The EPA Home Environmental Checklist provides information for low-cost trigger remediation. The slides that we've done on triggers specifically also provides you with information on trigger remediation. Provide needed tools. So all of the health homes are going to have access to some tools for reducing home environmental triggers, along with strategies for implementing these. But you want to make sure that we're matching up the remediation with the child's known triggers. Otherwise, it's going to become too overwhelming for the family. Document the items that we're providing to the families. That's going to help us see if these strategies help down the road with controlling the asthma. When you provide tools, you want to follow up at the next home visit to see what progress the family has made and if it's made a difference in the child's asthma. Finally, you want to be encouraging to the family. Figuring out triggers and making progress with remediation is a process. It can be daunting, particularly to low-income families. Be their champion. If they don't make progress this time, see if you can figure out why. And see if you can help them. Be a cheerleader. They have enough people in their lives that they feel like are judging them. We want to be their partner, not another person that is making them feel like they're not capable of helping their child. So the final and very important thing that we're going to talk about is closing the feedback loop with providers. So it's important to communicate to the child's primary care physician and any asthma specialist that is involved in their care what you've seen and what you've done in the asthma home visit. The information that you can provide to the team really can help them provide better medical treatment to these children. So key things to provide to the physicians. Were the medications and devices present in the home, and did the family know how to use them? Did the family have the asthma action plan present, and also how well did they understand the plan? Let the physicians and medical team know what you did to help engage the family around the asthma action plan and help them better understand how to use it. If we're successful in increasing their knowledge of the asthma action plan, this should be evident to the providers during their upcoming clinic visits. If families are struggling to identify triggers, let the doctors know this, because this is something that the physicians can play a key role in helping to sort out. And then identify to the physicians any major environmental concerns that may be impacting the child's health status, and the physicians may be able to partner with you to brainstorm ideas that could be done to help the family address these. Thank you for joining us for this presentation of Keys to a Successful Asthma Home Visit. Please join us for additional asthma trainings. We look forward to seeing you in the future.